We're joined today by Wayne Reich, CEO of the Pennsylvania State Nurses Association. Last year, Pennsylvania began to allow out-of-state nurses with an interstate license to practice in Pennsylvania. Before we get too detailed into it, can you explain what the Interstate Nurse Compact is and how it works in Pennsylvania?
Absolutely. So the Nurse Compact is an agreement through the National Council of State Boards of Nursing that allows nurses in certain states to practice across state lines in different states without doing any additional licensing or being licensed in that state. So a nurse can get one license and go practice in multiple different states under that one license.
Can you talk a little bit about the nursing shortage in Pennsylvania and how this Interstate Compact has perhaps addressed some of that?
Sure. In Pennsylvania, we've always had a need for more nurses. But what this does is it allows nurses from other states to come in, and it allows them to come in quicker than what they had in the past. In the past, you'd have to sit and go through different processes and certifications to get the allowance to come to the state. So what it will do is it allow more nurses to come in much quicker than they had in the past.
Who all does the nursing compact, Interstate Compact, apply to?
There are, I want to say, around 30 some states that are a part of that, or in some stage of it. So we're not fully implemented yet in the state of Pennsylvania, but hopefully we will be soon. Representative Frank Burns just introduced legislation to clear the last hurdle. So hopefully we'll be seeing in a couple months fully enacted compact in the state.
And are there various classifications of nurses, LPNs, RNs, nurse practitioners? Can you explain who specifically this applies to?
Right now it's just registered nurses and licensed practical nurses. The compact for advanced practice nurses is different and separate.
Are there any limits on what kind of healthcare facilities can utilize the nurses from the Interstate Compact?
No, not at all.
What's the burden on healthcare facilities to verify that a license from a nurse coming from out of state is in accordance with this compact? Sure.
There's a couple different ways to check nursing license that's available for the public. The State Board of Nursing has a license verification, and there's also a national nurse system where anyone can go and look up someone's name. If you have the first and last name, you can verify license.
Where is Pennsylvania currently in terms of implementing our participation in the compact in terms of allowing Pennsylvania nurses to practice in other member states?
So right now, the compact passed in summer of 21. Unfortunately, what we weren't aware of is that the State Board of Nursing in Pennsylvania isn't authorized to work with the FBI to do the fingerprint checking, which is a vital process. So our holdup has been communicating with the Department of Justice and the FBI to see what language or legislative fix there had to be to allow that process to happen. And within the beginning of April, Representative Frank Burns introduced legislation that would allow the State Board of Nursing to task the Pennsylvania State Police to run those fingerprint background checks and then report back to the State Board of Nursing. So once that is passed through the legislature, I believe they have 30 to 60 days to enact that. And at that time, nurses should be able to, from Pennsylvania, be able to practice in those other states.
Can you talk a little bit about what you've heard from members of the legislature response to the compact and how well it's being received?
I believe everyone's very excited about the process or the ability for nurses to bring more nurses in quicker. So I've not heard any negative concerns about the compact.
You'd mentioned this legislation actually went through in 2021. Pennsylvania was able to begin receiving out-of-state nurses in September of last year.
Yes.
Why has it taken so long for implementation and getting to where we are right now with Representative Burns' legislation?
Sure. So a couple different reasons. The state's not always the fastest at working through processes. And in this case, state departments had to work with federal departments. So the issue was between the Department of State having to go through the Pennsylvania State Police and then also going through DOJ down to the FBI and getting what language they needed to participate in that process. So that process took much longer than what anyone wanted it to. And we did hear a lot from nurses frustrated with that process and with legislators frustrated with that process. So luckily, everything's come through and we're right on the cusp of implementing that now.
Now, you had mentioned once again that the legislation is going through the House right now.
Yeah.
Do you have any timeline for when you expect that to finish going through the legislative process, moving forward to implementation?
I've not heard of any timelines, but I do believe this is a big priority for legislators, and I know it is for nurses, so I do believe it's going to be as expedited as possible.
Do you have a sense of how many nurses in Pennsylvania are interested and would participate in an interstate compact?
I don't. But I know that this is one of those issues that we've heard a lot from our members about what's going on, where is it at, and why isn't it being implemented. So I know it is a big issue among Pennsylvania nurses and nurses outside the state who live in neighboring states that want to come to Pennsylvania.
Can you talk a little bit more about what this compact means for patients?
Sure. What it means to patients is access to more nurses. And we know that the more nurses there are, the better care and patient outcomes there are. So for patients benefit from this immensely.
Are there any concerns with keeping in mind the Pennsylvania nursing shortage, that if our nurses are able to practice elsewhere, do you have any concerns about perhaps staffing pay comparisons, or any concerns about losing Pennsylvania nurses to other states that may pay better?
So I don't know if pay is the big issue. In Pennsylvania, we have, I like to think of the working force as a bucket. And, the incoming nurses we fill the bucket with. Unfortunately, in Pennsylvania, we have a leaky bucket right now. And we have a lot of nurses that are leaving the profession or leaving in general. So I think the key to keeping nurses in Pennsylvania and at the bedside is making sure that we're addressing issues that are driving them away from the bedside. And some of those issues are safe staffing, burnout, workplace violence, and issues like that. I always advocate for more money for nurses because they deserve more money. But money's not always the leading issue of nurses leaving.
Do other interstate compacts exist for other healthcare disciplines?
Yes. A lot of different healthcare professions have their own compacts. I can't really speak individually on those.
Are there lessons to be learned, or perhaps are you aware of anything that maybe we've taken from other healthcare compacts that is being utilized as this was being crafted for Pennsylvania?
I would say to join the compact, it's very stringent, so that everyone has to follow the same kind of rules to make sure that we're practicing within the rules and regulations that we should practice. And that does vary differently between different professions. So that would vary. One of the things I would say is if other states want to join, I would tell them to make sure they explore that issue fully about their state board of nursing in the process of running those background checks.
Now, you talked a moment ago about the nursing shortage, and you've kind of talked very briefly about some of the reasons. Can you expand on that a little bit? Maybe some of the biggest concerns of somebody that's in the profession and why they might be experiencing burnout and so forth.
Sure. So burnout, there's many issues to burnout. One of it is excessive workload. Having to do more with less. And the more patients that a nurse has, the more struggle it is to provide that care. And there's something called moral injury with nurses, where nurses really do want to do what's best and what's ethically right. I mean, we've been highlighted as the most ethical profession for over 20 years now, and I don't see that changing. And when we're in situations where we don't feel like we can do that best, it causes this moral injury, which is another reason why nurses leave the bedside. Stressful work environments, taking care of patients in high-risk areas, coming through COVID added to that. But these are all things that happened before COVID, too. They were always there. I think COVID just highlighted some of those. So we're looking at ways to kind of mitigate those burnout factors and keep nurses at the bedside. Unfortunately, what we're seeing now is nurses are coming out of school, going into the profession, working for a couple months and going, wow, this is not what I signed up for, and then they leave the profession. If we're lucky, they go back to school and become advanced practice nurses, but we're seeing more and more younger individuals just leave the profession altogether. So really what we need to do is plug those holes in that bucket and keep nurses at the bedside, make them want to stay at the bedside.
What other specific tactics would you like to see employed to help keep them at the bedside?
Sure. We're really pushing really hard right now for mandated ratios. So what we would establish is, this is all research-based. Pennsylvania is one of the leading researchers at University of Penn, with Dr. Linda Aiken, leading the charge for minimum ratios in different areas of hospitals. So in certain areas of the hospital, you would only be able to have so many patients per nurse. And what studies have shown is when those are implemented, better care is given, better outcomes for patients. It saves millions of dollars per hospital, and nurses are happier and patients are happier.
Perhaps this ties right into a piece of legislation, the Patient Safety Act. Can you talk a little bit about specifically what that legislation does and what's
Yes, and that's really important to note. PSNA has been pushing for this legislation, for staffing legislation, since I started at PSNA back in 2008, and probably even before that, where we know that nurses at the bedside need that help. And our legislation does three important things. One, it establishes minimum ratios in areas of the hospital. Two, it provides a safe haven for nurses, that nurses can report these issues and not be afraid of any of any retaliation. And the third it does is it makes sure that the Department of Health can enforce those regulations and follow up with that.
Are there currently any sort of mandated staffing levels?
In our state, no.
What are the risks that you see happening right now due to that lack of staffing ratio?
I think what we're seeing is higher healthcare costs. The Hospital Association put out a survey saying that they have a 30% vacancy rate at hospitals. So we're seeing nurses aren't staying at the bedside because of these burnout issues, and it's too much work for them.
What factors help you to determine what an appropriate ratio is, and does it vary depending on perhaps a different floor in a hospital or a different healthcare area?
It does. So in different areas of the hospital, such as the ICU, where a higher level of care is required, it's different. We looked at national organizations, such as the American Association of Critical Care Nurses. We looked at OB ratios. We also looked at Dr. Aiken's research as well, looking at what is the ideal ratio in those areas. So it's all science-based.
If you look at other states that may have ratios, is there a tie between having a safe patient ratio and nurse retention?
We do see that, yes.
Do other states exhibit similar nursing shortages as Pennsylvania does?
So sometimes I feel like the nursing shortage is kind of overblown. I think it's a way for hospitals to not address the retention issue. So I think there's research done through University of Penn and through the Health Resources and Service Administration that show in 10 years we're going to be at 9% short of nurses. Pennsylvania produces about 6,000 new graduates a year. The key is to keep them in nursing and keep them in Pennsylvania.
Are there things that the state can do to help bring interest to the nursing profession, particularly for young students that might be coming out of high school and considering what their next career step may be?
Yes, there's been packages introduced recently that will help with scholarships and grants that in exchange for tuition assistance, students would be required to work in Pennsylvania for a certain number of years. And then, one of the big things too is we have to make nurses happy so they tell other people that nursing is a great profession.
Mm-hmm. What works in other states to help attract nurses to the profession?
In the states that have the mandated ratios, we don't see as big of an issue with that. Money is an issue sometimes, but again, it's really hard to say how much money it takes for someone to overlook some of those other burnout issues.
Are there other things that Pennsylvania can do to help expedite perhaps the lag between when somebody graduates nursing school and obtaining their license?
Yes, I do believe we need some state board of nursing reform. I think studies have shown that the State Board of Nursing is understaffed. We have the largest board of all the boards in the state with over 250,000 registered nurses. So they need more staff to help process and expedite those processes. There's also some redundant issues where they're having registered nurses verify certain requirements where a computer system could do that. Now the state is in the process of looking at new systems, so hopefully that will start speeding that up as well.
To shift on to another focus, there have been calls for nurse practitioners to have full practice authority. So first of all, for those that are not familiar, can you explain what makes a nurse practitioner different than a registered nurse or an LPN?
Sure. So there are classifications of nurses called advanced practice nurses. Nurse practitioners are one of a group of 4. They are registered nurses that have gone back to school for a master's degree and then sometimes a doctorate. And what they're able to do is see patients, prescribe medications, and they act as like a primary care physician in a primary care in a primary care facility. Also, they work in specialty areas as well. So they're kind of a step up above a nurse, a registered nurse, in the ability to diagnose and prescribe.
You talk a little bit about the specific responsibilities, but what would be the benefit of giving nurse practitioners this full practice authority?
So right now in the state of Pennsylvania, a nurse practitioner can practice independently as far as prescribing medications and diagnosing. But in Pennsylvania, we have something called a collaborative agreement. So every nurse practitioner has to have 2 physicians as collaborative physicians as part of their agreement. And what we're told that does is provide supervision and reassurance to make sure that the nurse practitioner is practicing the right way. But what states have shown us and what studies have shown us is that's not needed. And some physicians are charging nurse practitioners a fee for that, but not actually providing any services other than their name is on paper. So in 25 or 26 other states, nurse practitioners don't have that collaborative agreement, and the outcomes are just as good, if not better, than family practice physicians.
What concerns or objections do you hear against a nurse practitioner having that full practice authority?
So this has been going on for at least 12 years, and I've only ever heard one group come out against this, and that's physician groups. Mm-hmm. And physician groups claim that nurse practitioners need that extra level of double checking, and we don't believe that, and studies show that that's not needed. It appears to be more of a control than anything else. And it's important to note that we don't want to take physician jobs, and these nurse practitioners don't want to be physicians. They want to be nurse practitioners. And nurse practitioners work very collaboratively. When issues are more complex, they refer to other providers, and when they have questions, they collaborate.
Under the proposed legislation, what would a nurse practitioner need to do to qualify for that full practice authority? Sure.
As part of the compromise, what was agreed to is that they would work 3,500 hours, the equivalent of 3 years, with a collaborative agreement. And at the end of that period, they would be able to not get that agreement anymore. So that's the main push with that right now.
You talked about some concerns and objections coming from the field of doctors. Are there any risks of having nurse practitioner practice without having a collaborative physician as part of their team?
We've not seen that in any research study or in any of the other states that have fully implemented that.
Can you talk about these other states that do have fully implemented nurse practitioners having that authority, and how does
Sure.
it work there?
In those states, you go through, you get your license, your certification, and you're free to practice independently. We see that in those states that have independent practice, we see more nurse practitioners opening up clinics in rural areas. And in Pennsylvania, we have a real struggle right now with care in rural areas. And what we believe that we have this group of professionals that are ready to go to those areas. We just need to remove that one last barrier to let them do that and provide care to people in areas that don't have that care. I just recently heard a story yesterday of a hospital closing and 10,000 patients suddenly being told they don't have primary care anymore. And 2 nurse practitioners developed their own clinic and started taking on those patients about a year ago, and now they're up to 3,000 patients. Unfortunately, the costs that are associated with it is a struggle, but they're meeting that need in that area where no one else stepped forward.
Can you talk a little bit more about this legislation, the response it's receiving from lawmakers, and what the trajectory is, what you see regarding it moving forward?
Sure. So this is in both houses right now. It's in the Senate and in the House. We're hopeful. It has passed through the Senate in past sessions, and we're hopeful that we can get it through this session. We would just really need to push it through the committee that it's in right now to get it out.
What will you and the State Association of Nurses do in these last 2 months of the legislative session to help move your agenda forward with the legislature?
Sure. So we are working with a lot of different coalitions. So with the advanced practice, we're working with the patient, with the nurse practitioners, the Pennsylvania Coalition of Nurse Practitioners. With safe staffing, we're working very closely with some of our other partners with moving that forward. So in these final 2 months, we're really pushing hard for safe staffing and for the advanced practice for full practice authority.
Wayne Reich, CEO of the State Nurses Association, thank you very much for joining us.
Thank you.